All right, and this week is National Infertility Awareness Week. So we're debunking some of the myths for women's health. And joining me now is Dr. Rashmi Kudesia, a Houston fertility doctor. Thanks for coming in studio.
Thank you for having me.
So we've been talking about how we were going to debunk some myths. What are some common myths that you hear from patients about infertility?
Well, I think the first is that it's solely a woman's issue. So for straight couples, about a third of infertility cases are related solely to a male factor, and about another third could be a combination of female and male factors. And so I think that's an important concept, that when couples are trying for a while, it's not happening, come in and do a semen analysis for your male partner as well.
So you can find out where the problem is, and does that help you better treat the couple?
It can definitely. Now, up to 20% of the time, we can do the standard evaluation. Everything more or less comes back normal, which is incredibly frustrating. It's what we call unexplained infertility. And perhaps that's another myth, that we can always find the answer. But it's important to come in and do that evaluation, because oftentimes there is something targeted we can approach.
So you, even if nothing is wrong with either of the people in the couple, you can still treat them, because clearly not telling them to keep trying isn't going to work.
Exactly right. And I think that's another myth, is that people often get told, well, just relax, it'll happen.
Don't stress.
Don't stress, yes. And I think nothing could be more triggering and honestly hurtful than to hear that kind of advice. Everybody's already trying to reduce their stress.
And that's frustrating advice, because clearly they've tried.
Of course.
So tell us about, I see we're looking at video right now. What is the impact of, we know that women are having babies later in life. How does age impact infertility?
So for females, we're born with all of the eggs that we're going to have. So the longer that egg waits for its turn to be released, the higher the chance of accumulated genetic issues. And so there's a lower chance of getting pregnant month to month and a higher chance of a miscarriage. That's really the predominant thing. We also eventually run out of eggs. And so even when we turn to things like IVF or in vitro fertilization, the fewer eggs we have, the lower the chances of success. And so there's kind of a complicated relationship. Both quantity and quality go down as we get older. Yeah,
it's not going to really help so much. So is there a time that you should definitely know to go in? I mean, if it doesn't happen for you in, 6 months, a year, when should you seek somebody's treatment, from an office like yours?
Absolutely. So if you're having regular cycles, no obvious issues, then if it's 12 months of trying or more, if you're under 35, 6 months of trying if you're over 35, if you've had 2 or more miscarriages, or if something just seems off, the cycle is irregular, there's a suspicion of a problem, very painful periods, other issues like that, then you might even come in sooner for just evaluation and reassurance.
How common is it that somebody's cycle is irregular?
It's actually a minority of women that have that textbook 28-day cycle, so it's incredibly common actually for folks to be irregular. And I think unless you've tried the ovulation predictor kits at home, you don't always realize how frustrating they can be. It's not always so obvious to figure out exactly when you're ovulating when you're trying to time things properly.
Wow, so it's actually more common to be irregular.
Yes.
I had no idea. And is there a way to treat that so that women know when ovulation is occurring?
Yeah, so many women will track their cycles either through an app, which are not perfect. All of these things have, certain reasons that they can fail, but home ovulation predictor kits kind of work like home pregnancy tests. They're urine kits that you can utilize to help, note exactly when you're ovulating. And so even if there is a few days of variation here or there, it might help pinpoint that perfect time for you.
So you think those are pretty accurate? They help?
They can be. I think if it lines up, everything is lining up together, you're getting consistent input from your app, from the tracking that you're doing, then that sort of makes sense. But oftentimes people find discrepancy, and so that's really the time to come in and get evaluated so we can make sure you're not losing time just by improperly timing things.
And so let's focus a little bit on that, because when we talk about treating infertility, I know a lot of people who maybe struggled in the beginning and they say, but I don't want to do IVF. Yeah. They don't want to go to the doctor because they don't want to jump to IVF. But there's a lot of things you can do before you get to IVF, right?
That's absolutely correct. There are more minimal things like using just oral medications like pills that can help support the ovulation process, maybe get multiple eggs to grow, particularly for those older patients where we just said that some of those eggs are going to have genetic issues. There are things like inseminations that we can do for a male factor situation where the sperm count could be a little bit low. These are much more simplistic and cheaper treatments. That being said, insurance coverage is constantly rising, and part of that initial evaluation is figuring out what your insurance will actually pay for. And so I always encourage people to come in for that evaluation, get that information and do the testing, and then decide, what treatments they're willing to consider or not.
Because more and more insurance companies are covering it. I'd say in the last 10 years, 10 years ago, it was like nobody covered this. Everybody was paying at least $15,000 to have a baby. And now sometimes it's fully covered.
Absolutely.
Which is shocking.
Yeah, and fantastic. And really it's a state by state thing. And so it's just really kind of frustrating to be governed by which state you live in. But increasingly also fertility preservation, so egg or embryo freezing, is another thing that folks should consider if they're in their early to mid 30s or beyond and want to have genetic children, but in the future, then that's another option that is also increasingly being covered. And so it's another thing to explore. You get those younger eggs and then you can utilize them at a later time.
Yeah, and if you are of an older maternal age, you just definitely want to get checked out sooner rather than later.
Yeah, exactly. Don't want to waste time.
Yeah. Thank you so much for coming in. Anything else you'd like to say before we let you go?
No, I just think it's an important thing to reduce the stigma around. You shouldn't feel that there's something wrong with you if you're not getting pregnant immediately. It's just like any other disease. Come in, get checked out, get the information. I think that's the most important thing.
Excellent. Thank you so much. We appreciate it. Hope to have you back in again soon.
Absolutely. Thank you.